Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will learn what cerebral palsy is, the types of cerebral palsy, living with both cerebral palsy and epilepsy, signs and symptoms, and treatment options. Cerebral palsy is defined as a group of neurological disorders that affect both motor and developmental skills. Cerebral palsy affects movement in different parts of the body, causing problems with gait, muscle tone, and coordination. According to the Center for Disease Control and Prevention, 1 in 345 children in the United States are diagnosed with cerebral palsy. Cerebral palsy is caused by damage to the fetal or infant brain, specifically in the cerebrum, caused by bacterial viral infection, hemorrhaging in the brain, head injury, asphyxia or lack of oxygen to the brain, prenatal exposure to drugs and alcohol. Spastic cerebral palsy is the most common, making up 77% of all cases. Spastic cerebral palsy makes up 77% of all cases. Spastic cerebral palsy causes damage to the motor cortex and pyramidal tract. Common signs of spastic cerebral palsy are abnormal walking, jerky reflexes, permanently tightened muscles and joints, and localized body stiffness. Athetoid cerebral palsy affects 2.6% of all cases. Athetoid cerebral palsy is caused by damage to the basal ganglia and/or cerebellum. Common signs of athetoid cerebral palsy are involuntary movements in the face, torso, or limbs, feeding issues, posture issues, and stiffness in the body. Ataxic cerebral palsy affects 2.4% of all cases. Ataxic cerebral palsy is caused by damage to the cerebellum. Common signs of ataxic cerebral palsy are tremors, reduction in muscle tone, difficulty speaking, and issues with depth perception. Hypotonic cerebral palsy affects 2.6% of all cases. Hypotonic cerebral palsy is caused by damage to the cerebral cortex. Common signs of hypotonic cerebral palsy are low muscle tone or floppy muscles, lack of head control, and lack of balance. Mixed cerebral palsy makes up 15.4% of all cases. Mixed cerebral palsy is caused by damage to more than one area of the brain. Mixed cerebral palsy is multisymptomatic due to it affecting multiple areas of the brain. There is a heightened risk for epilepsy for people with cerebral palsy, especially for children. 3 to 6 per 1,000 children are diagnosed with epilepsy as well, and occurs at a higher rate for children than adults. If the person has an accompanying learning disability, the risk of epilepsy rises to 71.4%. Prevalence of epilepsy varies with each form of cerebral palsy. Motor and intellectual difficulties that are seen with patients with cerebral palsy and epileptic seizures stem from the same underlying pathology. Nearly half of children diagnosed with cerebral palsy, especially with limited mobility, will also be diagnosed with epilepsy. Quadriplegic spastic cerebral palsy has the highest proportion of patients with epilepsy. The correlation between cerebral palsy and epilepsy are likely due to brain injury. Cerebral palsy stems from injury to the brain before, during, or after giving birth. Injury to the brain increases the chance of abnormal brain activity, which can trigger a seizure. Some causes for cerebral palsy and epilepsy overlap. Examples are low oxygen levels, head injuries, infections such as meningitis, and abnormal substance levels. According to the Birth Injury Help Center, the following anti-seizure medications are used to treat children with cerebral palsy who are experiencing seizures: phenobarbital, clozapine, phenytoin, and carbamazepine. In conclusion, cerebral palsy is defined as a group of neurological disorders that affect both motor and developmental skills. Cerebral palsy affects movement in different parts of the body, causing problems with gait, muscle tone, and coordination. 3 to 6 per 1,000 children are diagnosed with epilepsy as well. It occurs at a higher rate for children than adults. If the person has an accompanied learning disability, the risk of epilepsy rises to 71.4%. Nearly half of children diagnosed with cerebral palsy, especially with limited mobility, will also be diagnosed with epilepsy. To learn more about cerebral palsy and epilepsy, please check out our resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.